Then where you all can ask if you have any questions. And this is the first part where we are discussing the true false type questions, and the part 2 will be we are going to cover 17 SBA, single best answer type questions. So this one, Sudhir, can you hear me?
Can hear, sir.
Right, okay, right. Right, I'm not going to go behind all of those details regarding those theories here. Now, I think you all are gain up to the certain knowledge, and you are now in a position where you can just go through the MCQs and you can tell whether they are true or false. So we are not going to discuss about those basic things. We are just giving you the guide and the this kind of making you familiar to the exam setup and to those new MCQ types, right? So when it comes to these type of questions, these are the more familiar and more practical questions which can appear in your exam, right? Rather than those ordinary forensic stuff and those theories, they are not going to ask. They are going to ask about more practical things, right? So these MCQs are based on those type of practical events and the practical setup where you have to face those practical events while you are working as an intern, and after the intern you have to deal with these type of scenarios, right? So that's why those modern type of MCQs are changed from those ordinary type of MCQs to this type of new practical MCQs where you need the basic knowledge and the basic practical knowledge regarding management of those scenarios. They are not going to ask from you those ordinary theory related things. Those are now expired things, right? So the first one, true or false, we are discussing only 17 true false type MCQs today, and the part 2 will be the 17 MCQs related to single best answer type questions, right? Okay, the first one, true false regarding injuries. Imprint abrasions occur due to tangential force. As we discussed, imprint abrasion is due to perpendicular force. Tangential force causing graze abrasion. So this is wrong. Imprint abrasions occur due to perpendicular force, right? So the answer is false. Graze abrasions involved in deep layer of the skins. As we earlier mentioned, the graze abrasions occur with the tangential force. So the involvement of the deep layers are highly unlikely, right? So the graze abrasions involve deep layers of the skin. That is false. In generally, that is false. Usually, that is false because the graze abrasions occur due to involve the superficial layers of the skin, right? Abrasions heal without scarring. Generally, yes, right? So you have to take it as true, right? So if anybody willing to answer, you can answer. So we'll do like this. We are not wasting that much of time. We'll just read the statement sentence, and we'll ask somebody to either tell it's true or false, or anybody can send a message to the chat box, or if you're willing to answer, you can just give an answer to either true or false, right? Or I'll ask from anyone randomly. So that's not, we are not trying to make anyone uncomfortable, just to ask to get an idea rather than not trying to make anyone uncomfortable, right? So the next one, contusions always exhibit a characteristic color change pattern. Anybody can answer? True or false? Right? As we mentioned, what is contusion? That's the extravation of the blood from the vessels, right, to the extracellular space. So they are the 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 contusion, not like hypostasis. Contusion should absorb to the circulation uh, by the macrophages and those mm, uh, lysis activity, right? By the uh, enzyme activity. So because of that, it always undergoes a characteristic color change pattern where there's a uh, red color, blue color because of the lack of oxygenation, then it become green color, then the biliverdin, bilirubin, those changes may engulfed by the macrophages, and that cascade always exhibit a characteristic color change pattern. Yes, they are, but when those color change pattern can use to uh, determine the age of the contusion, right? So the correct one is, if the yellow color is there, that means the contusion is not less than 18 hours. That's the only reliable uh, uh, the time period we can give. Other than that, there's the difference, but usually the color changes comes with the red color, then the blue color, then it become green color, yellow color, brown color. There's a pattern, right? So contusions always exhibit a characteristic yellow color change pattern. Yes, that's true, right? Lacerations always happen due to blunt force trauma. Anybody can answer, right? I'll ask from someone. Just say true or false enough. Pasan Gunatilaga. Can you answer? I just randomly checked, the name appears in the front end, so I asked. True or false?
False.
Why? Then we have to ask why. Lacerations always happen due to blunt force trauma. Is there a laceration which caused due to sharp force trauma? Do you know anything? I just asked, right? I'm not trying to uncomfortable you. Just asked. Okay, Pasan, it's like this. Laceration, that's always due to blunt force trauma. We don't find any lacerations due to sharp force traumas, right? If it is a sharp force trauma, that is uh, either cut injury or stab, right? So abrasion, yes, abrasion can happen with the blunt force trauma or with the sharp force trauma, where those tip of the blade of a knife can cause small abrasion rather than a laceration. So that when it comes to abrasion, abrasion can happen with the sharp force trauma and the blunt force trauma. But when it comes to lacerations, lacerations always, it's a blunt trauma. So it is always happen with, due to blunt force trauma, right? So remember that, right? Grievous injuries include, second one, suture diastasis of the skull. What do you think? We'll ask Methila Moravakage. Methila, hurry up. Suddenly, ටක් ගාලා කියන්න. True or false? හොර නැද්ද? මිනිහා ගියා. මරුණාද නෑනේ? ඉන්නවා. Just true or false? Mic එක තාම off. මම කියන්නවා. What is suture diastasis? skull, there are sutures of the skull bone. Those skull bones get together with the diastasis. If those suture diastasis sutures are detached, that diastasis, that's also a kind of a fracture according to the limb G of the penal code. So that is grievous, right? That is, you can't get as non-grievous. That is grievous, right? Fracture of the nasal cartilage. Under limb G, that says not only the bones, it include cartilage. It include not only the fracture, the subluxation, dislocation, everything, right? So fracture of the nasal cartilage, dislocation of the nasal cartilage, subluxation, everything grievous. Patient unable to go to work for 15 days after sustaining injury. So that is according to the penal code. What is that? Grievous hurt. That is not 15 days. That is up to 21 days, right? After 21 days, that include personal life, recreational activities, job, everything, right? So leisure activity, let's say because of this road traffic accident, I was planned to go to a musical show, so that was cancelled. So that also you can prove that your recreational activities, your leisure activities was there was unable to go for those things, and that is can consider as grievous, right? So the patient unable to go to work for 15 days, not 15 days, that is 21 days, right? Disfiguration of the front aspect of the chest. So what is that? Limb F. If you go to the grievous hurts, the limb F, this is false. Why? Not the chest, that is face and head, right? Head, if the it depends. Head mean under the if it is covers with the hair, so that is sometimes you can't take it as grievous. If sometimes there's a huge area of alopecia and a scar, so that is grievous. So though that's how you are going to take it, is either grievous or not. But disfiguration of the front aspect of the chest is does not consider as a grievous hurt, right? So that is false. Tension pneumothorax. So we'll ask from someone. Suramya Ratnayaka. Suddenly කියන්න. 10 seconds දෙන්න. නැද්ද කට්ටිය? කවුද මේ answer කරන්නේ?
False.
False. Why? Suramya, sorry. Kavindi, very good. Right. Rumesh, good. Yes, good. So that is patient. Do you need any intervention for this? You have to. Either patient may die or patient will die. If you are not doing anything, patient will die. Not may die. මැරෙන්න පුළුවන්ද? Let's say subcapsular hematoma of the liver. There's a subcapsular hematoma. So patient can die, may die. Either it can be rupture and patient die. But tension pneumothorax, patient will die. So it is not endangering life, it is fatal in ordinary course of nature. So not grievous, not endangering life, it is fatal. So far beyond grievous hurt. So that is fatal. So because of that, that is false. The answer is false, right? More than grievous. Okay. True or false? Third one, true or false regarding road traffic accidents. The primary impact is always found in the lower limbs in the pedestrians. As we know, pedestrian injuries, the lower limb injuries are around the knee joint, are the primary impact site. That is usually, right? When it comes to usually, where the bumper fracture, we are calling the bumper or the shell of the vehicle usually hit on the knee joint area. So that is usual impact is around the lower limb, in the lower limb, around the knee joint. But it is not always where the primary impact can be either anywhere of the body. Let's say a bus, the broad flat surface of the bus can hit on the back of the chest or side of the arm, or a side mirror of the vehicle can hit on the head. So that is not always, but usually, yes, not always. The primary impact is always found in the lower limbs in the pedestrian. That is false, because not always, that's usual place, right? Imprint abrasions over the body indicate a run-over injury. Yes, as we mentioned, what is imprint abrasion? That is because of the perpendicular force. That is the run-over injury, where you can find out tire marks. Tire marks are imprint abrasions, type of imprint abrasions because of the perpendicular force, right? So that is true. Motorcycle riders are more vulnerable to injuries than pillion riders. What do you think? Anyway, the motorbike, three-wheelers, pedestrians are the vulnerable group of road traffic accidents. There are people who are uh, facing road traffic accidents. Out of those, there are vulnerable people. Who are the vulnerable? Motorbike riders and the pillion riders and the pedestrians and the uh, three-wheel three-wheel rider and the passengers, right? So from that, motorcycle riders are more vulnerable to injuries than pillion riders. That is wrong, because that is other way. The pillion rider is the one who has a highest chance to throw away, right? Because at least the motorbike rider, even though he is highly vulnerable, he is uh, grabbing the handle of the bike that has a kind of weight of the bike. So the throwing away, uh, the vulnerability of throwing away is less in motorbike rider than the pillion rider, right? So the motorbike riders are more vulnerable to injuries than pillion riders. That is false, right? Motorbike riders are more vulnerable to injuries than a car driver. Yes, that's true, right? Okay, airbag can cause mandibular dislocation. Yes, if you go to our lecture notes where we discuss those things, pattern injuries, airbag injuries can cause mandibular dislocation, mandibular fracture. There are airbag related several injuries, right? So that's true. Okay. Uh, we'll ask from someone this one. The driver is more vulnerable to head injuries than the front seat passenger. Ranul Pereira. I mean, the name appears here. So I am asking that name, right? Not going behind the name list and asking from anyone. Uh, so the random name comes to my list. So I'm asking from them, right? So answer 10 seconds then, right? Okay. Who are the people who sending messages? Go down the chat box. A message done. Driver is more vulnerable to head injuries than a front seat passenger. Kavindi
False.
Siriran false. Arun Jagendran. Jaganendra. Arun false. Arun ne that Arun Kanut Hitia class. Okay. Right. Why? As we mentioned, driver is there's the steering wheel. Because of that, more vulnerable for chest injuries. There's no that kind of barrier in for the front seat passenger. Because of that, front seat passenger forward projection is high. So because of that, head injuries are more in front seat passenger than driver, right? So remember that the driver is more vulnerable to head injuries than front seat passenger, other way, right? That's false. Number 4, which of the following need an inquest following a death? Death, right? Elderly patient diagnosed with a widespread cancer. So in generally, you don't need, right? If you don't overthink, just think generally, right? If you are going to overthink, you will take it as false, right? Let's say the cancer, maybe he's undergoing the surgery, maybe somebody has given a drug and that can be allergy. So if you think in that way, you will take it as false, right? So but when it comes to generally, just think generally, right? Uh, not go behind. Don't dig and try to find out a different answer. Just think, right? Elderly patient diagnosed with widespread cancer, right? That's no need an inquest. That's false, right? Fall at home, even though whatever accidental or fallen on the ground, fallen inside a bathroom, whatever, that need an inquest, right? Okay. Self-inflicted cut injury. That's true, right? That need an even though it's self-inflicted, that must undergo an inquest, right? Snake bite, as we mentioned, those related to animal deaths, animals related death. So because of that, you need right. Okay, very good. Snake bite also, you need an inquest. That's during recovery of anesthesia. But you know that's easy. That's during the surgery, recovery, immediately after recovery. If there's a suspicious everything, there should be an inquest, right? Inquest and postmortem must in this. Let's say everything should undergo an inquest, then a postmortem, right? Sometimes elderly patient diagnosed with an widespread cancer, if we have a suspicious, we are sending the for an inquest. From the inquest, the inquirer of sudden death will give the cause of death rather than go for a postmortem, right? But in generally, elderly patient diagnosed with a widespread cancer, you can give a DC, death certificate, and send without an inquest. Okay, right. 5. Which of the following are true or false regarding head injuries? Retrograde amnesia is a characteristic feature of concussion. Retrograde or anterograde? Retrograde. It is retrograde, yes. Not anterograde. Anterograde is invariably it either it can be there or it is not there, right? But retrograde amnesia is there. That is the length of the retrograde amnesia is proportionate to the severity of the concussion, right? So that is in our lectures also, and that is in the definition of the concussion. So that is, remember that retrograde amnesia is a characteristic feature, right? Concussion lasts less than 6 hours. Yes, we mentioned if it is last more than 6 hours, that is not concussion, that is diffuse axonal injury, right? EDHs are more common than SAH. What do you think? All right, we'll ask from someone. Pasan Gunathilaka. අපි පසන්ගෙන් ඇහුවද ප්‍රශ්නයක් ඕනේ? Right, this one. Azara Rahim. Just give an answer, true or false. That's enough. Right. Romesh Sehan false. Arun false. Kavindi false. This is for this question, isn't it? Right. True. Kavindi true. Okay. So let's go. EDH, that's always traumatic. But when it comes to other SAH, that has a traumatic part and the natural spontaneous part, right? There can be spontaneous subarachnoid hemorrhage. There can be traumatic subarachnoid hemorrhage. But when it comes to EDH, there are no spontaneous. That's always traumatic. So always traumatic means the percentage is less. When it comes to other intracranial hemorrhage, that has a two parts, both traumatic and spontaneous. So that means the percentage is high. So that's how you diagnose. If you go to our lecture notes, we discuss those things. You know those things. I think EDH is because of its origin, only traumatic origin. So that is less percentage than the other intracranial hemorrhages, right? So that's how you are taking. More common than SH, that's false, because as there are hypertension, there are those rupture berry aneurysm, rupture of the congenital aneurysms that can happen in spontaneous intracranial hemorrhage, subarachnoid hemorrhage. So because of that, that is more common than EDH, right? In diffuse axonal injury, diagnostic histological features can be seen in a specimen of brain. That's an easy question. Yes, we discussed those things. You can see those retraction balls in histological sections and also CT findings, not like concussion, DAI, there are those features, right? Primary brainstem hemorrhages are well circumscribed. We discussed those things, where the primary brainstem hemorrhage, the secondary brainstem hemorrhage, how the origin, what are the differences. So they are the primary brainstem hemorrhages. Who is going to answer? We'll ask from someone. Arani Patirana. True or false? Quick answer. Quick answer.
True, sir.
Sorry? True.
True.
Yes, true. True. Rumesh, true. Kavindi, true. Right. Why? Because of its the position and the origin that is well circumscribed and solitary. When it comes to the secondary brainstem hemorrhage, those are stick-like, found on more centrally and multiple, right? So that's how you differentiate those things, right? You should know those things now. You can't say I don't know, because those are basic, right? 6. Sri Lanka Medical Council. It maintained the quality of the medical education. Yes, we discussed in a separate lecture where they are the one people who are maintaining the medical education also, in addition to maintaining the quality of the medical profession, right? Chart sheet issue after the preliminary proceeding committee, right? Can somebody answer? Mihinsa the always the nama. Yes. Mihinsa the always. Sorry, I don't know.
Himsa.
Mihinsa, sorry. So tell the answer.
True.
True. Why? Right, okay. We'll go to this one. False after professional. Yes, Kaudame Arun. Very good. After professional conducting committee. Yes, that's true. We discussed separately regarding the SLMC, what are the content of the SLMC and how they are proceeding, the inquiry procedure, where there are two types: preliminary proceeding committee and the professional inquiry committee. After the professional preliminary proceeding committee, they are submitting their findings to the professional committee conducting committee, where the professional conducting committee will inquire the matter, and then they will issue a charge sheet, not after preliminary proceeding committee, right? So that is charge sheet will be issued after professional conducting committee, right? Not after preliminary procedure. Okay. Filling court cases against medical officers. What do you think? SLMC එකෙන් ගිහිල්ලා ඩොක්ටර්ස්ලට නඩු දානවද? That's false. Yes. Rumesh, yes, you are correct. That's false. Why? They are doing an inquiry. SLMC itself, they are doing an inquiry, and they are, if the medical profession or whatever the relevant person found to be guilty, they are suspending their practice or the rights and everything, suspending their SLMC registration. Those things are doing by the SLMC itself, but they are not going behind the court and filing any cases against medical officers. But when it comes to the court case, if the court is uh, mm, court, there's an ongoing court case. For that, sometimes the court can request the SLMC inquiry findings, the result of the inquiry. Then the SLMC will hand over those findings to the those relevant courts, but SLMC itself does not go behind the courts and file any cases against any medical officer, right? Or any medical profession, right? So filing court cases against medical officers, that's false, right? Conducts inquest regarding medical negligence. Yes, we discuss civil medical negligence, criminal medical negligence, everything. They conduct an inquest, right? The Minister of Health appoints the president. True or false? Minister of Higher Education or Minister of Health? Yes, that's Minister of Health, right? Minister of Health appoints the president, right? Not the Higher Education Minister, right? Remember that. 7. True or false regarding abdominal injuries? Emergency laparotomy following a stab with a negative finding is categorized as non-grievous hurt. What do you think? There's a stab injury, so the patient comes to the ward. You are an intern at the surgical ward. You are and your seniors are discussing. You are doing a surgeon is doing a laparotomy where there are no injuries, just the stab goes inside and came out. So what is that? No injuries, so that is you can categorize as non-grievous. No, that is false. Yes, yes, that's false because you can categorize it as grievous under limb. There are more than 21 days, that also there, and under the muscle cut, there's the abdominal muscle layer, so that those both those limbs you can use and you can categorize it as uh, grievous hurt, right? When if it is uh, something happen inside the bowel, step to the bowel, step to the liver, step to the spleen, so that is then the category will go higher than to the fatal inordinate cause of nature. But when it comes to these findings, negative finding of the laparotomy, you are not categorizing it as non-grievous, that is grievous under those mentioned limbs. Subcapsular liver hematoma rupture is categorized as endangering life. What do you think? What do you think? Umesh, true or false? False, true. True. Okay. Umesh, last answer, true. So what do you think? Subcapsular hematoma is there, right? If it is not rupture, you can closely observe the patient whether it is going to be rupture or not. So if the closed intact subcapsular hematoma is there without rupture, so that is patient may die. There's a chance if it is rupture, patient can die. If it is not rupture, patient may die. You have to closely observe. But when it comes to a rupture, that is not endangering life. That is, there must be an laparotomy and evacuation of the blood and closing the bleeding site. Otherwise, patient will die, right? So that is not endangering life. That is more than endangering life. That is fatal in ordinary course of nature, right? Subcapsular liver hematoma rupture is categorized, right? Rupture, not the subcapsular hematoma. Let's say subcapsular hematoma is categorized as endangering life. Yes, that's true. But When it rupture, that is not endangering life, that is more than that, that is fatal, right? Patient will die. Okay? Remember those. From this, the whole idea changed and the answer is false, right? A single stab to the duodenum is fatal in ordinary course of nature. Stab, you are not going to, the stab to the duodenum, you are not going to repair it. What will happen? It can lead to chemical peritonitis, then the sepsis, and patient can die, right? There's a patient will die, right? Not may die. එහෙම වෙලා මැරෙන්න පුළුවන්ද? No, definitely die. So because of that, it is fatal. If the patient may die, that is endangering life, right? A single stab to the duodenum, that is fatal. Yes, that's true. Bladder rupture following blunt force trauma is categorized as endangering life. What do you think? Simple. D false. Yes, that's false. Why? That is again, patient will die. If you are not doing anything, patient will die. So there must be an intervention. Bladder rupture, so the urine is leaking. So you must repair the leakage and evacuate those extravasation of urine, right? So patient will die. So that is not endangering life, that is fatal. Let's say a bladder wall contusion, large contusion of the bladder wall without rupture, that is endangering life. You can closely observe what is going to happen, right? So that's how you should elicit those. If you know the theories, know those theories, you can elicit those things, right? Blast wave of bomb explosion predominantly affect the liver and spleen. What do you think? කියන්න බලන්න එකනේ. දේශිකා, sorry, my pronunciations are not good. Deshika Madura Peruma. Give the answer. කවුරු හරි MacBook කියලා දාලා then I'm not going to ask the questions. So MacBook. True or false? බලමු. පල්ලෙහා answers. Kavindi false. With Rumesh. E false. Why? Okay, blast wave. As we mentioned, blast waves damage those hollow organs, not those solid organs, right? Lungs, where there are different specific gravities, air, tissue, layers. When it comes to small intestine, large intestine, bladder, though they have those different specific gravities. They have different layers of specific gravities. So because of that, those blast waves affect predominantly to those hollow organs rather than those solid organs. So the blast wave of a bomb explosion predominantly affect liver and spleen. That is false. That is predominantly affect the stomach, small intestine, large intestine, and the bladder, right? So that is false. True or false regarding diffuse axonal injury? A, can be manifest within 6 hours of injury. So what do you think? කියන්න බලන්න. Nushadi Fernando. True or false?
False.
False.
It causes like immediately.
As we mentioned, the concussion is last up to 6 hours. Yes, if the loss of consciousness is more than 6 hours, you can't say it concussion. It is diffuse axonal injury. But that doesn't mean diffuse axonal injury can happen before 6 hours. If there's a severe injury, severe trauma, the diffuse axonal injury can happen suddenly after the trauma, right? But when there's a patient comes to your ward with loss of consciousness. And when you are doing CT, there are no any abnormalities, no any bleeding, no anything, no any pathological finding. The But you are tube and ventilating the patient, and the patient is not gaining the consciousness and after 6 hours. That means that is something beyond concussion, that is can be the diffuse axonal injury, but that doesn't mean that diffuse axonal injury will occur after 6 hours of trauma. Diffuse axonal injury can happen just after, immediately after the trauma, right? Can be manifest within 6 hours of injury. Yes, that's true. So this is, they are checking your definitions and those stuff, whether you are know those things correctly or not, right? So that can be manifest within 6 hours. Yes, of course, even though it is the concussion. If the concussion is last more than 6 hours, that is then goes to diffuse axonal injury. So that doesn't mean that diffuse axonal injury must wait to say this is diffuse axonal injury. If you get the CT, that you can say this is diffuse axonal injury immediately after the impact, right? So can manifest within 6 hours of injury. Yes, that's true, right? Category of hurt is always endangering life. What do you think? That is easy. Category of hurt is fatal. That can be in, you can't say always endangering life, because let's say there are three main categories, subsections of diffuse axonal injury: 1, 2, 3, mild, moderate, severe. In mild, you can say it either it goes with endangering life and FOCN both, right? So because of that, don't we can't say. But when it comes to diffuse, moderate and severe diffuse axonal injury, those are always FOCN, fatal inordinate cause of nature, right? So because of that, category of hurt is always endangering life. That is false, right? You can't say that, right? Not always. When it comes to, but from your level, they don't ask this one. Category level, category of hurt is always FOCN. They will not ask from you that there are levels, there are different categories, subsections. Just remember that diffuse axonal injury is FOCN, right? Fatal inordinate cause of nature. That is enough, right? To your level. Is associated with microinfarction of the brain. Diffuse axonal injury. What do you think? That's true, because as we mentioned, it when it comes to concussion, you don't find any pathological findings, any radiological findings. But when it comes to diffuse axonal injury, you can see the radiological findings, you can see those pathological findings, where those microinfarctions and the retractions balls, histological findings, retractions balls of the axons, everything you can see, right? Falling from a height is a cause. Yes, we mentioned either acceleration, deceleration force, shearing force, the rotation force, everything can cause diffuse axonal injury, right? Histologically, it can diagnosed by retraction balls. Yes, we mentioned earlier. Histological findings are there. Pathological findings are there, those microinfarctions. Histological findings are the retraction balls, and the radiological findings are there, the shattered brain and those microinfarction, everything. And those demarcations, gray matter, white matter demarcations are shattered. So those in radiological findings are there, and the clinical findings are there. Those patient is unconscious, GCS low, everything is there in diffuse axonal injury, right? Okay, 9. Regarding alcohol and related offenses. Lateral nystagmus is a clinical feature. Answer. Sanduni. Who is this Sanduni? Only Sanduni. True or false? Takkal again.
False.
Why? When it comes to vertical nystagmus, that is, you can say false, not false, but that is not associated with alcohol, but lateral nystagmus is a clinical feature. Yes, definitely. Yes, we discussed those things in our lectures also for alcohol forensic aspect of the alcohol. They are and the clinical features of alcohol. So the when it come to eye, tunnel vision, color blindness, lateral nystagmus, those are features, right? Alcohol causes decreased reaction time. So who is this? Anusaran. Anu, is it correct? Anu, Anus. Sorry, I can't read the name.
So
Right.
question, if it says horizontal nystagmus, is it true?
Yes, horizontal nystagmus, that is lateral nystagmus, everything, right? That is same. Horizontal, not the vertical nystagmus, lateral nystagmus, and that's also the horizontal nystagmus, right? Same idea. Horizontal, lateral nystagmus, everything same, right?
Thank you.
Okay. Ask from someone else. Harini De Silva.
So true.
True. Yes, that's true. Lateral nystagmus is a clinical feature. That is horizontal nystagmus, not vertical. Sorry, alcohol causes decreased reaction time. So what do you think? That's true. Alcohol decreases everything. Yes, you are correct, but not the reaction time. That is increase. Reaction time increase, right? So this is a famous MCQ true false type 1 because you miss this. You think that everything decrease. Yes, it decrease the it decrease the vision and it decrease the thinking ability, everything, right? But when it come to reaction time, it increased, right? Reaction time increase, right? Not decrease. If it is decrease in the reaction time, that is good, right? So it increase the reaction time, right? Remember that. Food in the stomach decrease absorption. What do you think? මෙයා කාවින්දී සෙනවිරත් එයා අපි අහනවා නේද මෙයා ආන්සර් කරනවා ගොඩක් මේවට right කමන්න anyway
True.
true yes alcohol absorption when it come to carbonated water in the stomach increase absorption. Yes, that's true. Carbonated water, why? It has the carbon dioxide, those Sprite, soda, and those Coca-Cola, everything. When you mix the alcohol with them, they have the carbonated water, they have the carbon dioxide. Those carbon dioxide released with the mixture of the acid in the stomach that cause those bubbles. Those bubbles will increase the surface area that where the absorption of alcohol is increased with the carbonated water. But when it comes to food decrease the absorption, right? So alcohol causes food in the stomach decrease the absorption. Yes, that's true, right? Driving skills are affected at 80 milligram alcohol concentration. What do you think? When it comes to alcohol uh, from the first alcohol consumption onward, it decreased the skills up to a certain level, but in generally we are taking as 80 milligram level. So that's the where the breathalyzer is activated. Breathalyzer give the color changes and where the driving skills affect at that level. So that is the ideal uh, margin. So you have to take it as correct, right? But it when it from the first intake onwards, the skills are affecting, but the driving skills at the 80 milligram level, right? So driving skills are affected at the 80 milligram alcohol concentration. Yes, that's true, right? The Minister of Health approved the breathalyzer that can be used by the police. What do you think? කියන්න බලන්න. අපි අහමු සඳුනි සුබසිංහ.
True.
True or false?
True.
Minister of Health is not the person who is approving breathalyzer. That is something comes with the Ministry of those the police related those ministry. Then ultimately come to the Inspector General of Police, where the Inspector General of Police is the person police. අපි පොලිස්පති කියන්නේ the police inspector general of police, he is the one who is approving those breathalyzers and specific police officers to check those alcohol test by using breathalyzer test. Then not the Minister of Health, right? Not the Minister of Justice, that is by IGP, Inspector of General Police, right? Approved the Minister of Health approved the breathalyzer. That is false, right? 10. True or false regarding court trials in Sri Lanka. The doctor can submit documents without attending to the court. What do you think? Chetana Amaratna. Just give answer, just true or false. Just we are discussing
sir.
with. Sorry, again, girl, Chetana, no? False.
True.
True. The doctor can submit documents. Yes, that's true. That part is true, right? If it is for the magistrate court, yes, you are submitting the reports and you don't want to attend. But when it comes to high court, if the high court is asked specifically you to attend, you have to attend, right? Submitting documents, and without you can't, when the high court asks you to come, you have to go, right? When it comes to high court, that is false. But the summon comes from the magistrate court, you don't want to attend. The doctor can submit documents without attending the high court, that's false. Not the, if it is come to magistrate court, yes, right? Magistrate courts, they don't have that proper authority, but they are summoned, they are asking warrant, they are asking the doctors to come and give some statement in special occasions, not generally, right? The doctor can submit documents without attending the high courts, that's false, right? If they ask you to come, you must, otherwise they will warrant you, right? JMO is not always present. Yes, that's an easy question. You know that in high court trials, JMO not always present, where they are asking the JMO to another particular doctor to come to appear there in a specific time where they want to take evidence, right? JMO evidence can be cross-examined by the courts. What do you think? Even though we are experts in medical field, the defense or the whatever the lawyers can cross-examine your opinions, right? You are, rather than you are giving the exact details, you can give your opinions as you are an expert witness. So they also cross-check those opinions and those findings. JMO evidence can be cross-examined. Yes, that's true. The doctor can claim for the attendance. What do you think? Saman kara උසාවි යනවා. ඒකට අපිට charge කරන්න පුළුවන්ද? What do you think? Fatima. Yes, that's true. The doctor can claim for the attendance, right? Doctor can claim. Doctor can claim. There are several methods to claim. So the doctor can claim for the attendance. A doctor with SLMC full registration is considered as an expert. What do you think? If you have gone through our SLMC lecture where we discuss those things, SLMC full registration is considered as an expert. Yes, not the provincial registration, not for the interns, but for the after your intern, when you are getting those full registration, you are an expert to the courts, right? True. Yes. Umesh, yes, true. Okay. Number 11. medical legal examination form, MLEF, where when you are in the wards, the police will come to the ward within the night with a person who is having bleeding from the nose or and with the medical legal examination form, and the medical legal examination form will be handed over to the ward or to the relevant nurse and saying that this person is found from somewhere or somebody assault, or the patient will say that police assault or whatever he's coming with, and with a MLEF, right? Is issued by the JMO. What do you think? MLEF? No, that is issued by the police. Police will bring it with the patient, right? It has 3 copies. What do you think? There are 2 copies. One is medical officer's copy, one is police copy. In addition to that, there's another copy which is attached to the police, the relevant book, and it will kept in the police. So ideally it has 3 copies, but when the police come to the hospital, they bring only 2 copies, right? So remember that it has 3 copies. One is always keep at the police post, right? So this is a kind of tricky uh, MCQ sentence where we all know that the MLEF has only 2 copies, but it actually has 3 copies, right? Is sent directly to the court on a receipt of summons. If let's say the patient is there, we are filling the MLEF, and we are keeping the medical officer's copy and the police copy, we are sending to the court. That's false. Why? We are giving it to the relevant police post of the hospital or to the relevant police officer who came with the patient and the MLEF. We are not sending the MLEF, medical legal examination form, to the courts. When the court won't send a summon, we are sending a MLR, that is called medical legal report. So that is, we are typing and sending. This is, we are just filling with handwriting and something we are writing. So this is different, right? The police can go to the courts with the MLEF and saying that doctor went through this patient and he's saying that this patient is consuming narcotics, the urine test positive for this one, and then the court can punish or whatever the things can do, send the patient to rehabilitation or whatever by the courts. But we are not directly sending the MLEF, medical legal examination form. We are sending the courts when we receive the summons. What is that called? That is MLR, medical legal report, right? Remember that. Last one. Sorry, D, can be filled only by a JMO. What do you think? Let's say you will be finishing your intern and you are going to a rural hospital as a MO PD in the night. The police come, you are the only on-call MO there. The police comes with a person who is suspect of a drunken drive. So you have to fill as a OPD on-call MO, you have to fill. So can be filled only by a JMO, that is false, right? E, is issued by those who have attempted to commit suicide. Let's say there's a patient in your ward, you are a surgical intern, there's a patient who tried to attempt hang himself, right? Attempted hanging. So are you going to inform the police? Yes, you have to inform the police and the psychiatric opinion and the JMO opinion. So because of that, police will issue a MLEF. So is issued to those who have attempted to commit suicide when you are in the medical wards. If there's a patient comes to your ward with a suspect of weedicide consumption to attempt suicide, so you have to inform the police and the police will issue a MLEF, right? So is issued to those who have attempted to commit suicide. That is true, right? Okay, this is another famous question. Suicidal cut injuries are characteristic by multiplicity. What do you think? Easy. These are easy. Netmi Rajapaksha. Answer. True or false?
True, sir.
Okay. As we mentioned, self-inflicted injuries, they are in accessible sites. Usually they are superficial multiple cuts with superficial abrasions. There can be the beginning of the origin of the injury is much deeper. Then there's a tapering effect at the end. That is a shallow abrasion, shallow injury or shallow abrasion. So that is the multiple parallel superficial abrasions or superficial cuts in the accessible sites, usually in the non-dominant site. Those are the features of uh, self-inflicted injuries, right? So the suicidal cut is also multiplicity. Yes, there are multiple attempted cuts and one lethal cut with attempted multiple superficial cuts. Damage to clothes over the wound. That is false. Usually, self-inflicted injuries are sparing of clothes are there. But when it comes to homicidal, stab or whatever the homicide stab or cut, they don't try to remove the clothes and cut. No, they are trying to stab or cut as soon as possible and ran away. So damage to clothes over the wound, that is false in suicidal, right? But when it comes to homicidal, damage to clothes over the wound, that is true, right? A suicide note can be present at the scene. Suicidal cuts, yes, can be, right? Not always, can be, right? Absence of tentative, hesitant cuts, that is false. Suicidal cuts are characteristic by presence of tentative cuts, hesitant cuts, right? As I mentioned, multiple superficial cuts with one lethal cut, right? Presence of defense wounds. What is that? Defense wounds means either those defense wounds are either cut injuries or blood injuries with the whatever the instrument used by the other party, where those are found on the outer aspect of the forearm, where those defensing the head and the vital areas by the hands or the lower limbs. So those are found on the outer aspect of the usually from the forearm, and if the using a sword, knife or sword, the defense is there at the first finger web area. So the present of defense wound mean that is a homicidal one, not the suicidal cuts, right? So that is false. Okay. Next one. Count. This is not count coup. This is contra coup injury, right? Contra coup injury. This is again true or false regarding contra coup injuries, right? Occurs in acceleration, deceleration injuries of the head. So what do you think? Lasit Lianagamage. Easy. If you know the theory, if you know the
True,
basic.
sir.
Yes. This is occurs in acceleration, deceleration injury means that let's say backward fall and head impact on the floor, right? So that is acceleration and a sudden deceleration. Yes, that's true. Brain injury is confined to occipital lobe. Usually, when it comes to backward fallen, the coup injury is there at the occipital lobe. Then the contra coup injury is there at the frontal lobe. So brain injury is confined to occipital lobe. That is false. Not always confined. So this is confined to occipital lobe. That is false, right? So why? There are the contra coup injury will be found on the frontal and the temporal area, right? Fracture of the orbital plates can occur. Yes, as we mentioned, because of the backward fallen, the force transmitted to the frontal area, the frontal lobe impact on the orbital roof, which can cause orbital roof fractures, that is orbital plate. So the orbital plate fracture is a feature of Contrecoup injury, right? Then the majority of cerebral injuries are seen in the upper aspect of the frontal and temporal lobe. That's true, right? Contrecoup injuries, the majority of cerebral injuries are seen in the upper, seen on the upper part aspect of the frontal and temporal lobe. That's true, right? Because usually the typical Contrecoup injury pattern is happen because of the backward fallen, and the occipital area is the coup injury, and the Contrecoup injury is found on the frontal or the temporal region. That's true, right? Contrecoup injuries only occur when the victim fall forward. That is fall, as we discussed, the Contrecoup injuries usually happen because of the backward fallen, right? You in the front forward fallen also, you can see the Contrecoup injuries in the occipital area, but it is very rare, right? But the typical injury pattern comes with the backward fallen and the head occipital area impact, and the coup injuries there at the occipital region, Contrecoup injuries are there at the frontal region, right? Okay, next one, an extradural hemorrhage. Okay, we discussed this one. Can occur spontaneously. What do you think? That is false. A false. Yes, Rumesh, correct. Why? It is only traumatic, right? It is always traumatic. Yes, you can say. Is fatal in ordinary course of nature? Yes, usually yes. Why? Let's say small extradural hemorrhage, let's say 1%, 2%, 10 less than 10 milliliter, that can be you taken as in danger in life, where without not doing any intervention. But when it comes to generally extradural hemorrhage, it is an where it's a it causing brain herniation, and it can cause brainstem hemorrhage, and then brainstem herniation, and everything happen. Ultimately, patient can die because of the cerebral edema, because of the expansion of the extradural hemorrhage. So because of that, it is you have to, patient will die. Because of that, you have to do an intervention, burr hole, and remove the, or craniectomy, or remove the extradural hemorrhage. So because of that, it is fatal, right? Is fatal in ordinary course of nature? Yes, generally yes, right? Is always associated with the fracture of the skull. Right, we discussed this one. So, is always associated. It is usually associated with, yes, true, right? Why? It is 80 to 85%, 75 to 85%. It is associated with, and with a fracture of the skull, but not always, right? There's a 10 to 15% chance there can be extradural hemorrhage without a fracture of skull, right? Is the commonest intracranial hemorrhage. We discussed that. As it is only traumatic, it is not the commonest. All the others have spontaneous natural part and the traumatic part. This is only have a traumatic part. So because of that, it is not a commonest one, right? Is invariably associated with the lucid interval. What do you think? Right. අරණි පතිරණ අපි යගේ ඇහුවද මතකත් නැහැ. Anyway, what do you think? It is invariably associated with the lucid interval.
True, true.
The thing is, it is usually, it is, as we mentioned, it is always associated with the fracture of the skull. That is false. Same as it is invariably associated with the lucid interval. That is false, because sometimes there are extradural hemorrhages without lucid intervals, right? That is not almost always there's no any lucid interval. That is not a because that is also 10 to 15%, not 10 to 15%. Yes, around 15%. There are cases where there are no lucid intervals, right? Okay, so because of that, you can't take it as correct, right? And extradural hemorrhage is invariably associated with lucid interval. That's false, right? Next one. The poison question, there are a high vulnerability that where you can get those poison, these toxicological cases where those are common these days, right? Especially those heroin. Let's say heroin, amphetamine is more common than cocaine, right? There's a high chance you can get a heroin or ice methamphetamine related question than cocaine, right? True or false regarding cocaine ingestion can lead to coronary vasospasm. Yes, we discussed those things where it can cause myocardial infarction. Why? Because of the cocaine ingestion can cause coronary vasospasm, right? Because it is a CNS stimulant. That stimulation gives a coronary vasospasm, right? It leads to pupillary dilatation. Easy? Yes, that's true. Yeah, that's true because Umesh, yes, true. Kavindi, yes, true. Because it's a CNS stimulant. Because of that, it causing pupillary dilatation. Can cause hypertension. When it comes to CNS depressant, it is causing hypertension. But cocaine, it is a CNS stimulant that cause hypertension. When it comes to heroin, acute stage, it is CNS depressant, it cause hypertension. But when it comes to withdrawal of the heroin, that cause hypertension, right? So everything we discuss in our lectures and in our MCQs, so you have to remember those things. In acute stage of heroin, that is CNS depressant, but when it comes to withdrawal, it acts as those hypertension and tachycardia. But when it comes to heroin acute stage, it causes bradycardia, it causes hypertension. But when it comes to cocaine, cocaine is a CNS stimulant where you can get tachycardia and hypertension, right? Cocaine is more potent than cocaethylene. We mentioned those things. Cocaethylene is a mixture of cocaine and ethyl alcohol. So the combination is more potent than cocaine itself, right? Cocaine is more potent than cocaethylene. That is false. The other way is correct. Cocaethylene is more potent than cocaine. Chronic cocaine uses causes nasal septum perforation. Easy. That's true. Why? The snorting of the cocaine, sniffing of the cocaine can cause continuous vasoconstriction of the nasal septum that can cause ischemia to the nasal septum and causing nasal septum perforation, right? Chronic cocaine use may cause nasal septum perforation. Yes, that's true, right? Okay, next one. Which of the following are true or false regarding consent? Right, one of the most important type of question where the consent is a separate lecture in our ethics topics. So the consent is very, very important. You have to know all the things related to the consent, right? Here we are covering almost all the things related to the consent. Should be obtained in a patient, in all patients undergoing surgery. Yes, that's true. If there's a surgery, you have to get the written consent from the patient or either from the guardian or the next of kin or the whoever the person in charge at the moment, right? Should be obtained in all patients undergoing surgery. Generally, yes, true. When it comes to, let's say, there are no any guardian, no any next of kin, the patient is brings from the road, following a road traffic accident by the people who are there surround the road traffic accident. Where in that kind of special situation, you can do the best interest toward the patient. You can do without consent, but in generally should be obtained in all patients undergoing surgery. Yes, that's true, right? Don't think about the special locations when you are considering as general. Should be obtained in all patients undergoing surgery. Yes, that's true, right? Females above 16 years can give consent for sexual intercourse. Yes, we mentioned that is true. Females above 16 years can give consent for the sexual intercourse. But for the males, there are no that type of one. Even though male is above 18, there are no any, no one can give the consent for homosexuality, right? That is illegal, whatever the age, right? It should always be obtained before commencing a human experimentation. Research, yes, that is true. For a research, you have to take from the, if there's a language barrier, from that language you have to take. Let's say a Tamil person is there, you have to, if he is saying that he can't speak Sinhala or English, so you have to take from Tamil, right? It should be always be obtained before commencing human experimentation. That's true. Cannot be obtained from a psychiatric patient. What do you think? කියන්න බලන්න කවුරු හරි. Okay, කොහොමද answer? Lasit say false. Arun say false. Rumesh say false. Yes, patient may be a psychiatric person. There can be intellectual impairment and everything. That doesn't mean that he cannot give the consent always, right? Sometimes if the patient is aggressive, patient is not obeying any command, and that type of situation, you can't take the consent. But when it comes to a patient in generally, even though he's having psychiatric disease, he is taking medicine and is in a controlled situation where you can take the consent, right? So cannot be obtained from a psychiatric patient, that is false, right? According to the Transplant Organ Act, proxy consent can be taken given by an adult who is above 18 years. What do you think? If you read the Transplant Act, or if you go through a lecture related to those things, we also discuss under our head injury lecture. According to the Transplant Act, proxy consent. Let's say you are above 18, you are giving your consent to take your organs if you are suddenly found brain death following a road traffic accident. That is called proxy consent. What do you think? According to the Transplant Act, that is false. That is 21 years, right? You should be more than 21 years to give your proxy consent to organ donation. But let's say a patient is married to a lady who is 19 years old and he is found to be brain dead at the hospital. Then the next of kin is above 18. When the patient is diagnosed to have brain death, she can give the consent. But to you to give proxy consent for take your organs, you should be more than 21 years, right? So remember that according to the Transplant Act, proxy consent can be given by an adult over 18 years. That is false. Okay. Right. 17. Last one. So we are exactly doing 17 true false questions and 17 single best answer type questions, as that is the same way in the new syllabus paper, where you will find 17 true false and 17 single best answers, right? The plants containing toxic substance which has direct effect on the CNS include central nervous system, where we discuss those which are the one affect the central nervous system, which are the one affect the the GI system, and what are the cellular poisons, right? So we'll see. Gloriosa superba causes rice water diarrhea. This is they are asking about this. Let's say the plants and the toxic substances, right? Just don't use this one, CNS one. The plants containing toxic substances. Which of the following are true or false regarding plants containing toxic substances, right? Gloriosa superba causes rice water diarrhea. What do you think? Gloriosa superba, that's easy. You know that. That is Niagara. That is GI system related one that cause rice water diarrhea. Yes, that's true, right? Richness communicus is CNS depressant. What is that? That is again Enderu, that is also related to GI, not related to the CNS depressant or stimulant. That is something else. That is same as Gloriosa superba, but the Gloriosa superba, usually the yam is the allele is the poisonous, but when it comes to Richness communicus, that is Enderu, that is seed. So those are accidental poisons. Gloriosa superba usually suicidal poison, and Richness communicus is usually accidental poison, but both giving GI symptoms, right? Adenia palmata is a cellular level poison. What do you think? Those are easy. There are no need to analyze. So no, you don't have to think. If you know the answer, if you have gone through the theory, you know the answer. Adenia palmata, that is Honella. That is again, it goes to the cyanogenic group. So that is cyanogenic group mean it is cellular level poison. So that is true, right? Datura stamonium causes dilated pupils. What do you think? Datura means Attana, that is like atropine-like features. Atropine, it is causing dilated pupils, right? So that is true. Right, D, true. Arbus precatorius seeds can be accidental poison. Yes, these are common pediatric, when you are doing pediatric intern, those are your common scenarios where those boys, school girls, they are in their interval or somewhere, they eat some kind of seeds and come to your ward. The teacher or guardian will bring you these seeds and show you and say, doctor, these are the seeds they accidental eaten. So you have to know those what are those poisons. So the Arbus pecatarius, that is called Olinda. That seeds are famous, that red and black color seed. So that is a kind of famous accidental poison, right? So you have to know the clinical features, you have to know the treatment and everything related to those things, right? That's why those are appear in your these exams, right? Okay, that's the end of this lecture. This is the part 1 of this mock paper. We will discuss another 17 single best answer type questions in near future without wasting your time. So I went through these 17 MCQs in a bit of quick manner, because now we are not detailed discussing those detailed discussion regarding those theory parts. Now you have to read those things and you have to refresh your knowledge, right? Okay, if you have any answers, you can send questions. That doesn't mean that some people are sending that in the morning, sir, what are the causes, what are the plant poisons in Sri Lanka? Those type of questions we are not going to answer. You have to know those things. If you have those questions, I got a question from one student that that's a genuine question. He asked about the sulfuric is inorganic or organic. Those are the genuine questions. But if you are not studying anything and in the morning suddenly you realize that I will ask from him what are the plant poisons in Sri Lanka. So that type of question I can't answer, and we don't have that much of time for those type of answers. That is a whole lecture. You have to read those type of things by yourself, right? Okay then. So if you have that kind of genuine question, you can send those questions. We are happy to answer those things, right? Right. Then we'll inform you the next date where we are going to discuss about those single best answer questions, right? Sudhira will inform you all. Okay then. Thank you very much. Thank you for listening. Work hard. Right. Good night.